You're listening to an African Elements top news story for July 18th, 2025. Please visit our website at africanelements.org for more daily news. The Prison to Psychiatric Pipeline by Darius Spearman. Incarceration brings a heavy toll on mental health, especially for Black men. The prison environment itself exacerbates existing mental health conditions. Furthermore, it can induce new ones. Research shows that experiencing incarceration is linked to later diagnoses of depression and bipolar disorder. For instance, individuals in jail are 3 times more likely to die from suicide compared to those in the broader population. Isolation within prison walls, along with a lack of social support, fuels feelings of loneliness and depression. In addition, the constant threat of violence or exposure to trauma within correctional facilities can lead to post-traumatic stress disorder, PTSD, or other serious mental health conditions. Harsh conditions and limited access to care within prisons worsen pre-existing mental health challenges. Moreover, the stigma attached to incarceration continues to impact individuals long after they are released, making it difficult to find treatment and reintegrate into society. Black men are disproportionately represented in the United States prison system. Although Black people make up around 13% of the United States population, they account for approximately 38% of incarcerated individuals. This disparity is not accidental. It is a consequence of deeply rooted structural racism that permeates every level of the criminal justice system. Every stage of the legal process, from policing and arrests to sentencing, demonstrates this imbalance. For example, Black men born in 2001 face a 1 in 5 chance of being imprisoned at some point in their lives. This overwhelming likelihood has profound consequences for the mental well-being of individuals and their communities. The number of individuals with mental health disorders within prisons and jails is alarming. More than 40% of those incarcerated have received a mental health diagnosis. Consider this: 1 in 4 people in jails experiences significant psychological distress. Psychological distress encompasses emotional suffering and mental strain, which manifests through symptoms such as anxiety and depression. Despite this critical need, many incarcerated individuals do not receive the mental health care they deserve. Only about 1 in 3 state prisoners and 1 in 6 jail inmates with mental health issues receive treatment after admission. Adequate treatment includes timely access to qualified professionals, appropriate therapy, and necessary medication. Unfortunately, this standard is often not met, causing symptoms to worsen within correctional facilities. Black Americans experience additional mental health challenges due to systemic factors such as racism and police brutality. Consider the profound impact of police killings of unarmed Black Americans. This tragically causes a significant mental health burden comparable to that of diabetes within Black communities. This comparison emphasizes the overwhelming scale of trauma and chronic stress experienced. Furthermore, racial disparities extend to how mental health issues are handled within the justice system. Black Americans with mental health disorders are more likely to be arrested than white Americans with similar conditions. Similar conditions refers to comparable diagnoses, symptom severity, or psychological stress levels across racial groups. This disparity points to biased enforcement practices that criminalize mental illness within Black communities. The current racial disparities in criminal justice and mental health are rooted deeply in historical practices. These include slavery, Black codes, and segregation policies. These historical oppressions systematically disadvantaged Black communities. They also limited access to critical resources that determine health outcomes. From mass incarceration to the mental health crisis, this legacy persists today. Systemic racism within American psychiatry compounds these issues. This includes institutional biases in diagnosis, treatment, and research that unfairly impact Black individuals. Problems such as misdiagnosis, inadequate treatment, a lack of culturally sensitive care, and exclusion from clinical trials perpetuate health disparities. Consequently, this erodes trust in psychiatric care within Black communities. Addressing these biases requires major reforms, including culturally competent training for professionals, diversified leadership, and inclusive research practices. While the focus often remains on Black men due to high incarceration rates, it is important to remember that Black women and other gender identities also face distinct challenges. An intersectional approach reveals unique barriers and discrimination within the criminal justice system. It also highlights different health disparities. Comparing mental health outcomes across genders within Black communities provides a more complete picture of the systemic issues at play. Black women face different policing patterns and unique forms of mental health stigma. Furthermore, Access to mental health treatment for all Black gender identities is often affected by gender roles, societal discrimination, and social expectations. Understanding these nuances is crucial because studies that focus only on Black men miss the broader systemic issues affecting all Black individuals. Therefore, a comprehensive approach must consider the varied experiences within the Black community. Moreover, it must incorporate solutions that address these distinct challenges. To truly address the mental health crisis among incarcerated Black men, comprehensive policy solutions are essential. One crucial step is reforming punitive drug and sentencing laws that disproportionately affect Black communities. Many jurisdictions are beginning to see the benefits of reducing extreme prison terms and decriminalizing drug possession. Furthermore, increasing funding for culturally competent mental health care within correctional facilities is vital. This means ensuring that mental health professionals are equipped to understand and address the specific experiences and traumas faced by Black individuals. Implementing diversion programs that offer alternatives to incarceration for those with mental illnesses can also keep individuals out of the criminal justice system entirely. Ensuring continuity of care post-release, along with providing support and resources, helps individuals transition back into society. Ultimately, addressing systemic racism through anti-bias training and diligent oversight of police and judicial discretion is paramount. Policy advocacy also aims to decriminalize mental health crises and expand community resources. These combined efforts work to reduce incarceration rates and improve mental health outcomes for Black men. They also promote mental health equity for all. Copyright African Elements.